So I just want to start by expressing gratitude to the Ehlers-Danlos Society for inviting me here today to discuss my experience living with EDS and postural or orthostatic tachycardia syndrome. My name is Francie Fitzgerald. I came down today from Philadelphia. So it's important for people to understand that while I've been invisibly disabled for the past 13 years, before I developed POTS, I lived a normal life, largely uninhibited by chronic illness, with the exception of numerous orthopedic injuries, growing pains, which we've heard referenced here today, and recurrent strep infections. By all accounts, I was a healthy enough kid. I was highly active through all of childhood, and by sophomore year of high school, I was a tri-varsity athlete with an offer to play Division I field hockey. That summer, I embarked on an exchange program to Cape Town, South Africa, where I raced for the school's track team and toured with their field hockey team. About halfway through my 2 months there, I got sick and was taken to my host family's family doctor, who told me I had glandular fever. After a quick Google search, I breathed a sigh of relief, learning that glandular fever was just the local term for what we here in the States called mono, or jokingly the kissing disease. Like I said, I was a normal teenager. So extraordinarily common infection, Epstein-Barr virus, usually leads to a short-lived bout of fatigue and various other symptoms that keep you in bed for a few weeks. Little did I know that upon returning to the US, my life would never be the same. As the months dragged on, I remained debilitated by fatigue and started to develop a plethora of other symptoms. Notably, one that was characteristic of POTS, which is pre-syncope upon standing, or nearly fainting upon standing. Not long after, I couldn't lift my arms above my head long enough to wash my hair without assistance. And safe to say that the development of POTS felt like having the rug pulled out from underneath me, and it took me years before I felt strong enough to stand back on my 2 feet and move forward with a new normal. It was admittedly a dark period of my life, made all the worse by lack of clarity, guidance, or support. Multiple doctors dismissed my symptoms as hysterical or psychosomatic, citing anxiety and school avoidance as the primary culprit. Thankfully, this was not something my mom could believe of her academic-loving daughter, who became a shell of herself. And my parents therefore pursued second, third, and fourth opinions until ultimately I was seen by the head of infectious disease at Johns Hopkins. We consulted the doctor there about the possibility of a recurrence of Lyme disease, which I had had in 3rd grade. And Dr. Atwater said he did not believe that this was the case, but instead he highly suspected that I had something called postural orthostatic tachycardia syndrome. And he referred us for official diagnosis at the Children's Hospital of Philadelphia in our hometown. From there, I was treated by cardiology, and the main focus was using medications and lifestyle changes to manage symptoms. It was, at best, a frustrating long road with little payoff, and at worst, led to great iatrogenic harm. That is a theme I really want to highlight today, the great prevalence of iatrogenic harm in POTS and EDS patients. Ultimately, the autonomic nervous system is responsible for helping the body maintain homeostasis across all its systems, and POTS is a form of dysautonomia, or dysfunction of that system. So if you can imagine treating so many disparate aspects of the body in a hyper-specialized medical field, then you can picture the tremendous amount of time, energy, and resource that was required to see the relevant physicians. In preparation for this, I was going through a list of all the doctors I had seen and trying to remember as many as I could, and came up with a list of close to 139, I believe. So therefore, you can appreciate the lack of collaboration across these specialties and guess the negative effects of being treated by so many different people. Oops. Amongst those negatives was the lack of consensus on what was actually going on with me. Trying to piece together the puzzle of mounting symptoms and why I was unable to recover from a simple Epstein-Barr virus infection led me to 3 top institutions over the course of a year, concluding I did not have EDS. It was not until 4 years later that I would have whole genome sequencing that indicated the likelihood of a connective tissue disorder, and I would finally be assessed using the Ehlers-Danlos Society's diagnostic criterion and diagnosed with hypermobile EDS. While these diagnoses, including others like ulcerative colitis and small fiber polyneuropathy that I would come to acquire over the course of years with illness, were helpful in channeling me to the right professionals and in securing insurance coverage for various pharmaceuticals, ultimately there were still countless environmental and psychosocial factors that caused exacerbations in my symptoms and proved extra difficult to manage. Amongst these things that caused the most pain and perturbance are cold weather, rapid changes in temperature, rapid changes in the barometric pressure, even slight sleep deprivation, alcohol and other food sensitivities, psychological stress, change in altitude, any type of infection, and hormonal fluctuation with my menstrual cycle. Any one of these can severely impact my day, not to mention what happens when multiple pile on top of each other. In order to create as much of a buffer from those aforementioned stressors as possible, I maintain a rigorous commitment to daily routines. These measures include low-impact exercise, copious amounts of salinated water, mindfulness meditation, wearable devices like the sauna mask shown here, and a specifically tailored and timed diet, which all help create a semblance of stability. Most of all, though, what is necessary is the prudence and patience to embrace pacing, according to my body's fluctuating capacity, and adapting when that resilience is tapped due to whatever stressor is mounted against me. In order to get to a place where I was open to approaching life differently, I first needed to do a hell of a lot of railing against reality, fighting to get back to 100%. But after years of doing more harm than good and getting tired of banging my head against the wall, I started to grieve the loss of my presumptive future, which finally helped me to accept a new normal. Toward this end, I have benefited greatly from psychotherapeutic modalities, including mindfulness-based stress reduction, acceptance and commitment therapy, and radically open dialectical behavior therapy. In large part, thanks to this psychological work, I was able to make peace with my situation and pursue school and work accommodations that enable me to serve in a fulfilling role as a master's level mental health therapist who specializes in treating chronic suicidality. What a privilege it is for me to spend my days helping others build their lives worth living. None of those things would have been possible, though, without the validating community that rallied around me through good times and bad. Apart from my partner and family, the single most supportive being in my life up until his passing this past August was my service dog, Patty. Patty healed something in me that at the time no human was capable of touching. And in anything I do for the rest of my life, I will be honoring his legacy. Ultimately, my gains have been as a result of lifestyle modification coupled with the best pharmaceutical management we could contrive. What I want you to hear is that I have trialed an obscene number of medications in an attempt to support functioning and reduce symptoms. In the process, I have suffered through brutal side effects, and this is because we don't have effective standards of care based on research. Even in treating my most well-understood condition, which is ulcerative colitis, I have gone through a great number of failed therapies and endured life-threatening repercussions. The knowledge about the conditions from which I suffer are insufficient, and the tools with which doctors can treat me are so limited. We so badly need extensive research to overcome these hurdles in restoring people to a semblance of wellness. Not only that, but we need education that can create the conditions for more doctors, like my beloved neurologist and quarterback, Dr. Soria, to lead with validation and empathy instead of the all too often encountered skepticism and blame. If I were to identify one dialectical dilemma, which of course I had to do as a DBT therapist, that is most harmful to patients like me, it is the polarization on either end of the spectrum of treatment. On the one side, POTS and EDS patients face traumatic invalidation, leaving them without help or hope, as mentioned earlier, pushing people to depths of despair characterized by suicidal ideation. And on the other end, we see these same patients encounter groups of doctors who throw the kitchen sink at their laundry list of symptoms and sometimes do more harm than good as a result of polypharmacy and dangerous side effects. I want to highlight some of my most dangerous complications I've experienced at the hands of well-intentioned but poorly equipped physicians. Amongst other things, I've been hospitalized for drug-induced pancreatitis, multiple bouts of aseptic meningitis, acute myopia that resulted in the inability to see for a few days, multiple spinal fluid leaks that required blood patches, and blood clots and central line infections. My sincere hope is that together we can find a middle path that is guided by evidence-based standards of care backed by research. Thank you for having me here today and taking the time to listen to my testimonial and my plea for superior research and care.